Hello everyone. Do you know pediatric lung surgeries are different from adults? Yes, they are different because the anatomy and physiology in children are different. There are unique disease pattern in children and potentially there is a long-term growth plan. So how does anatomy and physiology differs in children? In children, the airway is very small caliber and it is very flexible. So it easily get obstructed from outside or within, and that's why it requires a delicate anesthesia for the surgeries. Second thing, the rib cage in the children's is elliptical in shape. Rather than in adults, it is more or rounded shape, which leads to decreased oxygen reserve in children's, and that leads to early failures. Third thing, the diaphragm between the chest cavity and abdomen is having less muscle content, so that get easily fatigue. Fourth, a most important thing, as lungs are in growing stage, they grow till the age of 8 years. So the alveoli, that means air sac, are so small, the moreover the space required for oxygenation is less. So that leads to less reserve in oxygen concentration, and that leads to early failure. So that requires specific and qualified anesthetists with qualified surgeon to deal with such conditions. Now, if we see the condition which we deal with the pediatric lung surgeries, they are by birth, like congenital cystic adenoma malformation. There could be sequestrations. There are plenty, sometimes diaphragmatic hernias, and they are acquired. Like after birth, like pneumonia is complicated into empyema. There could be lung tumor. There could be mediastinal tumors, which require specific surgery. All the children who underwent surgeries are having better results with the experienced thoracic surgeon with pediatric thoracic anesthetist, because as lung is growing stage, they are having better results and compensating growth is much better in children than adults. Second thing, with minimal invasive techniques like video assisted thoracoscopic surgery, the scar will be less. There will be less morbidity related to open surgery like spine deformity and scoliosis. There will be less hospital stay and early recovery. So, whenever you find any lung conditions which require surgery, consult a pediatric thoracic surgeon as early as possible.